Welcome. I'm so glad you could join us today. My name's Aline Sigler. I'm with Provider Outreach and Education. Also on the line with me is Leanne Foster. She's serving as my co-host today. I want to thank her for her help. There are also a couple other members of the Provider Outreach and Education team online. I want to thank them for being here as well. Today we're focusing on the basics of skilled nursing facility and swing bed providers. During our time together, we're going to define some key terms. That's a big thing in the Medicare world. We're going to take a look at the coverage criteria for skilled care, whether that's in a nursing home or in a swing bed in a hospital. We're going to briefly review some billing and payment information. And then towards the end of our time together, we're going to look at some resources where you can go to get even more information. One last item that I want to mention is if you've attended our webinars in the past, another thing that we are doing recently is adding the legal disclaimers at the end of the presentation. You can find them there, and that's what this little note down here is telling you. I just wanted to bring it to your attention if you hadn't seen it previously. This course is designed to be a beginner level or entry level class. So we're going to start with a few definitions to help us get started, make sure we're all on the same page, because Medicare can be a little overwhelming sometimes. And so one thing that I want to remind you of is not to kill yourself trying to memorize everything, because you can always go back to the regulations and the resources and find where that information is, and most importantly, get the most updated information, because Medicare does change sometimes. So our first definition is the definition of skilled services. What exactly do we mean by that? Medicare Part A covers Medicare certified skilled care. But what makes a service skilled? Skilled care is nursing or other rehabilitative services. They're provided according to a physician's orders. A skilled service requires the expertise of a qualified technical or professional health personnel. So this is people like registered nurses, licensed practical nurses, physical therapists, occupational therapists, audiologists, speech language pathologists. So not just an aide or an assistant, but the services require the skills of a certified personnel. Medicare considers a service skilled if, because of its complexity, it can only safely and effectively be performed by or under the general supervision of skilled nursing or skilled rehabilitation personnel. So the next term that we're going to define then is general supervision. It requires initial direction and periodic inspection of the actual activity. But this doesn't mean that the supervisor is always physically present at the location where the assistant performs the services. Medicare is a physician-driven program. Many services have to have written orders and periodic checking back in for those services, care plans, reevaluation, certification, recertification. Those things are a big part of the Medicare program. So many services have general supervision as a requirement. The next term that I want to define for you is swing bed. If you're new to Medicare or you only have skilled nursing facility knowledge or experience, this is one term that can be a little bit perplexing. I know it was for me. When I first heard it, it wasn't anything that I was familiar with. Now, if we go back to the Social Security Act, which is where the Medicare program started, the Social Security Act permits smaller rural hospitals to enter into a swing bed agreement. With CMS approval, these hospitals can use its beds as needed to provide either acute hospital or skilled nursing care. So they're hospital beds, but they can swing from acute to skilled care depending on the needs. In order for payment to be considered, all the same coverage criteria that freestanding skilled nursing facilities have to follow is also required. A benefit period is a way to measure coverage for Part A claims. So there's a specific number of days for inpatient hospital care and skilled nursing stays. If we go back for a second to swing beds, remember we said they were a hospital, but when the patient swings to skilled care, then that patient is going to be using their skilled nursing benefit days. So that's why I thought it was important to kind of define these things, to lay that groundwork, to help you build your knowledge and understand skilled nursing coverage. A benefit period begins the day a patient is admitted to a hospital or a skilled nursing facility as an inpatient. A benefit period ends after a period of 60 consecutive days where the patient is facility free, meaning they're not an inpatient at any facility, or they're in a skilled nursing facility or a swing bed stay, but at a non-skilled level of care for 60 consecutive days. You may hear a benefit period referred to as a spell of illness. And I try not to use that term. I know I've been around for a while, and so sometimes I do slip and find myself saying it. But referring to that as a spell of illness kind of makes it sound like a benefit period is based on a specific diagnosis, and it's not. It's also not based on calendar year. A patient can have multiple benefit periods in a single calendar year, or they could have one long benefit period that lasts several years. So these are some definitions for you, things that I wanted to make sure that you had a high level understanding of before we went forward, because when we talk about skilled and non-skilled care, it's important to understand those things because there is a difference. Medicare doesn't pay for care in a nursing home just because that's where the patient is. There's a lot more that goes into it as far as the coverage criteria is concerned. And that's the next thing that we're going to be talking about. So we're specifically talking about original or fee-for-service Medicare today. And we're talking about enrollees in original Medicare because they have to meet certain conditions to qualify for Part A skilled services. So I've listed the criteria here. We'll go down the list and then we'll talk about each one of these in a little bit more detail. So those requirements are starting with a 3-day prior hospitalization, also known as a qualifying hospital stay. The second requirement is called the 30-day transfer. Third, they have to have skilled days remaining in their benefit period. And finally, they require a daily skilled service. This could be skilled nursing care, skilled rehab services, or both. So we're going to take a closer look at each one of these things to help you better understand what Medicare's requirements are. So starting with the 3-day prior hospitalization or the qualifying hospital stay. The patient was an inpatient for a medically necessary stay. Medically necessary is very big in Medicare. Anything that's not medically necessary, if there isn't a specific benefit category for it, unfortunately, Medicare probably won't cover it. So it's a medically necessary 3-day stay, and it's 3 consecutive calendar days. This could be at one or more hospitals. We do get that question a lot. Does the patient only qualify if the 3 consecutive days happened at the same facility? And no, it is actually written in the manual that it can be 1 or more stays as long as it's 3 consecutive medically necessary calendar days as an inpatient. Time spent in observation or the emergency room does not count towards that qualifying hospital stay because the patient isn't at that point formally admitted as an inpatient. This is a question that you might get from patients or their families. Well, I spent the night in the hospital. Doesn't that count? And unfortunately, it doesn't. The patient has to be formally admitted as an inpatient by their physician. When you're counting those days, count the date of admission, but not the date of discharge. No inpatient facility gets paid for the date of discharge, so that can't be counted. There are exceptions in Medicare, and you see one listed here. One exception to be aware of is that some patients who are enrolled in a Medicare Advantage plan, those Medicare HMOs or managed care plans, some of them don't require a 3-day hospital stay. And if the patient disenrolled from that Medicare Advantage plan or that Medicare Advantage plan goes out of business, there are special billing rules that you'll have to follow to report that to us. And that's a little more in depth than we're going to get into today, but it's just something to be aware of, that there are some managed care plans that can waive that 3-day qualifying stay for their enrollees. It doesn't happen a lot, but we do see it on occasion. So you can keep that in the back of your mind. A bit more about the qualifying hospital stay. To be covered, the extended care services must have been for the treatment of a condition for which the beneficiary was receiving those inpatient hospital services, or a condition that arose while in the skilled nursing facility for treatment of the condition that made that prior hospitalization necessary. And I know that that's a mouthful, and you can read more about that, get the actual words from CMS for this requirement in the internet-only manuals. This one happens to be in the Benefit Policy Manual, which is 100-02, Chapter 8. That's where you can find information about these requirements. So it has to be 3 consecutive calendar days. It has to be a medically necessary stay, and that skilled care needs to be related to that inpatient hospital stay. We spent a lot of time on that requirement because it is a big one. If a patient doesn't have that qualifying hospital stay, then that skilled nursing service, whether it's in a SNF or a swing bed, is not going to be payable by Medicare. The next requirement that we want to talk about is called the 30-day transfer. So the patient has to be transferred to a Medicare certified skilled facility or skilled care within 30 days from the hospital discharge. So that's what CMS means by post-hospital extended care services. Post-hospital means if initiated within 30 days. You see here that there are some exceptions also to this, and as you learn more about the Medicare program, you'll learn that those requirements and those regulations do have exceptions because not every patient's situation is the same. If both of these situations occur, more than 30 days from hospital discharge might be acceptable. So the first one is if the patient's condition makes it inappropriate to start active skilled treatment, such as rehab, immediately after discharge, and it's predictable that skilled care will be needed in a predetermined time frame. An example of this might be a patient who broke a hip. They may not be weight bearing for several weeks before they can safely start an active treatment of physical therapy. It's just an example, but I think it's a common one in the skilled nursing world. So I hope that helps kind of illustrate what we mean by that 30-day transfer and then what that medically predictable time frame could be that would alter that 30-day requirement. So medical appropriateness, medical exception, and it's a predetermined time frame. So if we go back to our patient with the broken hip example, they go to the hospital, they get it repaired, they're in the hospital, and they're going to need skilled care. We know that they're going to need physical therapy, but they can't start that physical therapy for, let's say, 6 to 8 weeks. And I'm not a clinician, I'm just making that up. So it's medically appropriate that they're going to need skilled care, and it's a predetermined time frame. That's 6 to 8 weeks or whatever it is. So I hope that helps kind of illustrate that for you. The patient also has to have skilled nursing facility benefit days remaining in their benefit period. We've defined what a benefit period is, how it starts, how it ends. But in order for Part A to make payment, if all of those other criteria are met, the patient has to have skilled days remaining in their benefit period. Each benefit period has a total of 100 days for skilled care. Medicare covers the first 20 days in full after the Part A deductible is satisfied. Normally, the Part A deductible will get applied to the hospital claim, but not necessarily. And what I mean by that is Medicare operates on a first in, first out basis. So if for some reason the hospital claim or claims, because remember it can be more than one place, if it gets held up, it's got a billing error or it's held up for medical review, then the Part A deductible could be applied to the skilled nursing facility claim. So it just depends on which facility's bill is received and processed first. So it's important to remember also that the Part A deductible is per benefit period, not per calendar year. The Part B deductible is per calendar year, but the Part A deductible is due every benefit period. And again, it depends on that particular patient, how they're in and out of facilities, if they have that 60 consecutive day break where they're either not an inpatient at any facility or they're in a skilled or swing bed stay but at a non-skilled level of care for 60 consecutive days. So each patient could be a little bit different. So all things to take into consideration. After those first 20 days that are paid in full, days 21 through 100 do have a daily coinsurance amount that the patient or their supplemental insurance will be responsible for. And it changes every year. Congress decides how much it's going to go up, all of the deductibles and coinsurance rates. So for 2026, I will tell you that it's $217 per day. So I hope that gives you a little bit better understanding of the criteria that's required for coverage to be considered for skilled nursing, including swing bed services. So now I want to talk just a little bit about billing. We have an upcoming class that's going to focus more on billing, and then another class also that focuses on some special billing situations that come up in skilled and swing bed claims. So if you're listening to this class as a recording, look for those recordings as well. They're going to be subsequent dates. They are available for registration on our live events page. So let's start with frequency of billing. First of all, most provider types in Medicare bill per service. So a provider performs a service, they bill a claim. They perform a service, they bill a claim, and so on. Hospitals send one claim from admit to discharge. That's an inpatient claim. Skilled nursing and swing bed claims are a little bit different. They are required to bill monthly. A lot of patients in skilled nursing facilities or in a skilled stay are there for an extended period of time, weeks, or months maybe, sometimes years. So Medicare says those claims have to be billed monthly and in sequential order. So April's claim is not going to process until March's claim has completely processed and it's on the remittance advice. Also, skilled nursing facility and swing bed claims have to be billed when any of the things happen that are listed here. The patient discharges, so they leave the skilled nursing facility or the hospital and they go home, or they go somewhere else to another facility type perhaps. When they drop to what Medicare considers a non-skilled level of care. We have to keep track of that patient's stay. It's very important. When they have no more days left in their benefit period, they've used their 100 days and they're still in the facility, they could still receive Part B rehab and other things like that. And when they're enrolled in a Medicare Advantage plan. The reason for that, because we're focusing on traditional Medicare, that's all WPS processes is traditional or original fee-for-service Medicare claims. But if you have a patient who's enrolled in a Medicare Advantage plan and they're in a Part A stay at your facility, we still need you to send a claim to us. We call that an encounter or a shadow claim, or there might be other terms, but those are the main ones. So you're sending one claim to the Medicare Advantage plan for payment, and you're sending another claim to us to keep track of the patient's days, to keep that benefit period information up to date. So you'll notice this is pretty different than other provider types that we mentioned. Those professional claims, bill of service, complete a service, bill a claim, complete a service, bill a claim. Hospitals admit to discharge. So this is different, but these are the requirements for Part A skilled nursing facility and swing bed claims. I mentioned that we have another webinar that's going to go more in depth on billing. We'll talk about those billing situations, exactly what's needed by Medicare. This session is some basics, so we're going to be building on what we're learning today. I do want to share some reminders for you when billing skilled and swing bed claims. We establish that we have to bill monthly and in sequential order. Prior month's bill must finish processing before the next one is sent. Similarly, if benefits exhaust, wait for the Part A claim to process, whether part of the days will be paid or none of the days will be paid, before you send a Part B claim. That's just going to help you in the long run. If you don't do that, you run the risk of the claims kind of bumping into each other within the system, maybe taking longer to process. And so we're trying to give you advice to keep that from happening. Remember that when you're counting your prior hospital stay, the date of discharge doesn't count. So make sure you have those 3 midnights, those 3 inpatient stays at one or more hospitals. I know we haven't gotten into it yet, but for those of you who are currently billing and taking this course as a refresher, remember that a patient, if they're not present at midnight, we call that midnight census, because maybe they had to go to the emergency room and they're not back by midnight, or maybe they went home for the holidays or a special event, whatever the case may be. If they're going to stay all night with a family member or something like that, those days that they're not present at midnight in your facility is considered a leave of absence and a non-covered day for your facility. We're going to go over the specifics on actually how to code that on your claim in one of our future webinars. Be sure to use the correct discharge status code on your claim. That's really important too. If we don't do that, we can cause some problems. It can affect the patient's benefit period. It can also affect the amount of money that your facility receives. It can hold up other providers' claims, or it can even affect the patient. If the patient went to the emergency room and you thought that they were going to come back, but they end up being admitted at that hospital, you need to discharge. Make sure that the last claim that you drop has a 02 showing that they went to the hospital. We've seen situations where maybe someone accidentally bills a patient status code of 20 instead of 02. So that's actually a problem because a 20 indicates date of death. That will post a date of death to that patient's social security record. It can be fixed, but we just want to be careful and be cognizant of what we're typing and making sure that it's accurate. If the patient goes home, that's a 01. But then you find out later that they started a home health plan of care. Then that patient status code needs to be something different to properly connect that benefit period and show the status of the patient. It can also be a problem if the patient gets explanation of benefits or Medicare summary notices with incorrect information. It can cause stress and anxiety for them because they don't quite understand what's happening. We've gotten calls to our office from subsequent providers whose claims won't process because a prior skilled nursing stay, and sometimes many months prior, shows a 30 patient status, that the patient is still a patient, and the benefit period never closes. And so that's what I mean when I say it can impact things down the road. So that correct discharge patient status code is very important. It affects payment also. And payment is the next thing that we're going to talk about. So continuing on about our discussion with coverage, billing, and payment, the basics of them anyway. How are skilled nursing and swing bed providers paid by Medicare? Medicare provides a bundled payment for a lot of services, and covered Part A skilled nursing facility or swing bed stays are included in that. This is known as consolidated billing. Like a lot of facility or provider types, most skilled and swing bed services are paid according to a prospective payment system, or PPS. Of course, we have to have an acronym. That's just the Medicare way. Medicare pays skilled services per diem or per day under the skilled nursing facility prospective payment system. This payment covers all Part A skilled nursing services, which includes routine, ancillary, and capital-related costs. Primarily, those payments are based on the patient's assigned case mix group. The ICD-10 codes on the minimum data set, or MDS assessment, map the codes to what's called a patient-driven payment model clinical category. And I know that that's a lot to take in, but this is just a high-level overview of how Medicare calculates those skilled nursing facility prospective payment system payments to most, and I'm underlining most there, skilled nursing facility and swing beds. The patient-driven payment model then determines the payment by classifying the patient according to several criteria and patient characteristics. Of course, there's a lot more to it than that, but for today, that gives you a general idea. On our previous slide, I stated, and I tried to emphasize, most skilled nursing facilities and swing beds that services are paid according to SNF PPS. Swing beds in a critical access hospital are exempt from SNF PPS and consolidated billing. So this is another exception in the Medicare world. This is a unique provider type that we have, and at this time, they're paid according to reasonable cost rather than SNF PPS. It's important, though, to note that while a critical access hospital's SNF level swing bed services are not subject to consolidated billing, they are subject to hospital bundling. That requirement is for all hospitals, and critical access hospitals are not an exception to that. So it's another layer of understanding that we need to have, depending on what type of facility we're in, work for, or represent. Critical access hospital swing bed services are reimbursed according to the cost-based method, just like their inpatient hospital claims. So let me go back up one. Most are paid under the prospective payment system and use that patient-driven payment model and those different assessments. Critical access hospital swing beds are exempt from SNF PPS and consolidated billing, but hospital bundling rules do apply. And those provider types are paid by reasonable cost. So based on the actual charges on the claim. So as we go on here, the next thing is, if we go back to that prospective payment system and consolidated billing, under consolidated billing, the skilled provider is responsible for the overall plan of care for that patient. So if we think about it, that's where the patient lives, right? Maybe temporarily, but that's where the patient lives. They depend on that skilled nursing facility or that swing bed facility for everything they need during their stay. This could be directly, or it could be under arrangement with an outside provider. The skilled nursing facility or the swing bed provider has to submit all claims for all services that the patient receives, except, there's that word again, except for items and services that CMS has deemed specifically excluded. And when we're talking about SNF consolidated billing, we're not talking about excluded from Medicare coverage, like routine or experimental things, cosmetic surgery. We're not talking that kind of excluded. We're talking excluded from consolidated billing. We do have separate series of webinars focusing on consolidated billing. We hold them periodically. You can look on our live events page to see if any are upcoming that you want to register for. We also have a skilled nursing facility consolidated billing playlist on our YouTube channel. I always like to provide you with places where you can go to learn more about the topic that we're talking about. Depending on what your role is in your office or at your facility, the things that you might want to know about or need to know about could be a little bit different. So some resources for you is what we have coming up next. So what I've done here on this slide is provide some resources about consolidated billing. So if you want to learn more about it, you can do that. The first item is where you can read about the categories of services that are excluded from consolidated billing. The second item we have is the SNF Consolidated Billing webpage on the CMS website. That's a good resource for you because it has a lot of good information. Also gives you other links to additional material, other places you can go to learn more. The third bullet is a web-based training. This is a great interactive online course. And then the last bullet that we have for you here is that SNF Consolidated Billing playlist that I mentioned out on our YouTube channel. As we do more webinars that are specifically focused on consolidated billing, you'll be able to find them in that playlist. Now this slide has more resources for SNF and swing bed providers. 100-02 is that benefit policy manual that I mentioned. This is where you're going to find the coverage criteria, those regulations about the qualifying hospital stay, the 30-day transfer, the definition of skilled services, and those types of things. The second bullet is the Medicare Claims Processing Manual. And this is the manual that talks more about the billing and payment part of it. So Chapter 6 is dedicated to skilled nursing facilities and consolidated billing and things like that. Submitting those bills in sequential order, those types of requirements that we talked about. Now, the third resource takes you to the Skilled Nursing Facility Center or web page on the CMS website. And that's going to be your go-to for important messages. It's going to give you a jumping off point to a lot of other different resources and information. And then the last two bullets that we have here, we have a couple things on the Medicare Learning Network, which is CMS's educational hub or outlet there. So the first one is a SNF billing educational tool. And then we also have a fact sheet specifically about the 3-day rule. So I want to just peek at those real quickly here. If you've downloaded a copy of the slide deck, you have the live links here. If you're viewing this course as a recording, look in the description. I'll include all the resources there, the links to them. So in this billing reference, this is a good thing because it breaks it down into sections where you can go and get more information. So just as an example, how this works, you can navigate by using these green buttons or tabs here, and it'll jump to that particular section of information. So this is the first one. You can see it listed here. And then each one of these expand. So here's the definition of skilled services. Here's information about the benefit period. If you're looking more for payment information and some of the things that we just talked about, how most Part A claims are paid, links to other information, and then it goes into billing requirements. So this is an excellent way to get bites of information in easy to digest portions here. The other thing that I wanted to show you is this 3-day rule fact sheet. All of the things we talked about, how it can be one or more facilities, how it has to be medically necessary, how it has to be the skilled nursing stay or the swing bed stay has to be related to that inpatient stay. Sorry, I lost my train of thought for a second. All of those things can be found, again, in this fact sheet. If you are responsible for training new billers, new office staff, let's say, this can be useful for you as well. So I just wanted to make sure that you are aware that they exist, how to get to them, and how you can use them. I'm going to jump back to the PowerPoint and we'll continue on here. So this is the portion of the event where we ask for questions and answers. I didn't get any pre-submitted questions that I don't feel were answered within the presentation itself. So I'm going to check in with Leanne here. But remember that this class was designed to be an entry-level course. If you have claim-specific questions, we really need to direct you to customer service for those, because I don't have a way to access the system and look at those claims with you like they can. So they can really help you more efficiently and more completely when you call them. If we run out of time, you will have another opportunity to send in questions. So I want to check in with Leanne here. Leanne, have we gotten questions in the chat for today?
Aline, we have not received any questions in the chat today.
That's okay. I appreciate you being in the background and monitoring things for me and adding things to the chat, being my eyes and ears behind the scenes. So we'll just move on, and if you think of a question later, we'll tell you how to get that to us. We would ask that you complete a survey about this course. It only takes a few minutes, but you have the opportunity to tell us what you liked, what we could do better, and then, as I mentioned in the beginning, give us ideas for future education. Is there something that you want to know more about or that you're struggling with that we can help collectively for the provider, all the providers out there? You have a few options, so it just depends on how your preference is. You can use the link that Leanne's placed in the chat. When you exit the webinar, you're going to be asked to go to an external site, and that external site is the CMS Qualtrics page for the survey. You're going to see a page that has a box with a picture that looks similar to this, with the triangle and the continue button. I just want to explain to you what that is, because if you haven't seen it before, the verbiage doesn't really tell you what it's for, but it is safe and it is for the survey. If you're listening to this course as an encore, you're going to get a box that's going to link you to the survey, and it's going to look like this other example here with the hand and the stars. That'll take you to the survey. You can also scroll down in the description for this video and find the link to the survey. However you choose to do that, you only have to do it once, but please do that, and don't hesitate to give us your open and honest feedback. Those surveys not only give us insight into how we're doing, but also the types of education that you want and need. In a few minutes, in 10 or 15 minutes, you're going to receive an email, and it's going to thank you for attending. It also is going to contain a link for the survey, so that's another way you can get that feedback to us. But I don't want you to overlook or delete that email without reading it, because it contains your certificate of achievement. It has your name and contact hours. So if you need to turn it in for credit towards continuing education units, you can do that. You can check with your accrediting body, whether it's AAPC or someone else, and see how they want you to upload that into their system. Sometimes they don't require proof, but if they ask for it, that email is your proof of attendance. If you don't see that email, again, it should arrive in 10 or 15 minutes. Check your junk or your spam folder, and make sure that you add the WebEx email address to your safe sender list. If you think of a question later, you have 1 week from today to submit a follow-up question. You can send them to our same education mailbox. Put something in the subject line about SNF and swing bed basics in the subject line. That way they will be sent directly to me and I can respond. On behalf of myself, Leanne, everybody else in provider outreach and education, I want to thank you for your participation today. We hope to have you join us for future education, and we look forward to your survey feedback. You may now disconnect. Have a great day, everybody.